Okay, so good afternoon, everyone. Thank you for your time. I guess you're all just a little bit tired at this point, but I'll try to be concise and share the knowledge I had the opportunity to bring with me from returning from Seoul yesterday. And I would like to say that we all know as plastic surgeons that the world of aesthetic is shifting. There are new concepts now. Talking about HA is important, knowing about BDD and chemical bonds is important, but biostimulation is not a new concept. And it's not just stimulation. Regenerative medicine is evolving. And I think that we as plastic surgeons, we should navigate those waters with ease. We should not be embarrassed or too judgmental, I think, against these new concepts. I think we should open our minds and listen. And first of all, I think we need to learn. Because once we know, we can adapt, and that's what plasticity is all about. So the world is evolving. We are going from fillers to healers. We're talking about cell regeneration, we're talking about cell rejuvenation, and the world of aesthetics now doesn't want to see any more pillow faces. Our patients, they want to be vibrant, they want to look good, they don't want to look done. And I think that it is time that we join that party. So the main actor in this party right now is PN, or polynucleotides. I'm talking about REJURAN. REJURAN is a polynucleotide coming from the East, from the Far East. It's coming from Korea. And polynucleotides are mainly, they are fragments of wild salmon DNA. We are not talking HA-based fillers. We're talking biological fillers, biocompatible fillers. It is not a new concept. Okay, let me just go back a little bit. It's not a new concept. It's been on the market and injected for the last 11 years, over 30 countries, and I'm really proud to say that now it is also available in Israel. So this is my disclaimer, okay, for those of you who don't know me, and this is a sponsored lecture by Alpha Medics and Omega Medics and REJURAN Israel. So what are we going to talk about? We're going to talk about what are polynucleotides and what is the difference with PDRN. Maybe some of you already know it, polydeoxyribonucleotides. What is the mechanism of action? Because as I said earlier, knowledge is power. We need to understand what we are injecting and why, and what we expect of it to do, for our patients. What are the basic clinical indications, and what is our unique view? What can the plastic surgeon gain from this new filler, from this new technique? So why do I think we should embrace the change? We should not transform ourselves and do just aesthetic medicine, but we need to harness those tools. Like my colleague said before, we have a toolbox, and this is, in my opinion, a very important tool in our box. So REJURAN basically is made of polynucleotides, which are long fragments of DNA. It is the main component. We don't have HA in it. It is water soluble, but it is formed like a gel. Why salmon and why wild salmon? Because the ratio of the nucleotide bases. The ratio of AT to GC is the most close to the human form. They exert no immunological reaction, and we have no zoonotic viruses transferred through this medical device, because it is a grade 4 Korean medical device. So basically the difference between polynucleotides and polydeoxyribonucleotides is just the length. And the size, in this case, the size matters because it exerts different implications. Polynucleotides are derived from salmon testis, whereas PDRN is the salmon sperm that you hear on social media. it's very incorrect to talk about polynucleotides and said, I just got a facial, a salmon facial. It's not exactly the same. It is similar, but not the same. PN are large molecules over 1,000 kilodaltons, whereas PDRN is of 50 to 1,000 kilodaltons. They have different actions, mainly connected to the form, the 3D form. They have different viscosities. PDRN would be more watery, whereas PN would be more viscous as a gel, and we can use it as such. We have different products on the range. I'll talk, and we'll circle back to that a little bit later. And I won't bore you with the technical details, but it is important to know that we are talking wild salmon and not forel cultivated farm fish, trouts, or the difference between them is important. We'll see it also later on. We'll just go back to this slide, which I find very, very interesting, because we are talking about the content and we're talking about pollution. Okay, pollution in the wild salmon is the one in the green one that has the lowest environmental pollution, which is strange, but is the result of this study. It is also important to know that it is not a new concept. As I said before, it is on the market for 11 years. We have different articles, and I'll be happy to share them with you if you're interested later on. So what is the mechanism? How does it work? What does it do? Because we know HA, and we know that HA absorbs water. It is a volume replacement, basically, so REJURAN is not. So what does it do? It has mainly two-part mechanism. We can divide it in two parts. We have the biological properties. Using the A2 receptor agonist, it is possible to have an anti-inflammatory effect with a very strong growth factor stimulation, basically mainly VEGF and interleukins, we'll see later on, a very strong angiogenesis. And there's also the salvage pathway, which means that the molecule being broken down into the different nucleotide parts signals the cell that it is in proliferation, so it can heal, it can grow, and it can induce further DNA synthesis. It also has an anti-melanogenesis effect exerted by a tyrosine kinase inhibition pathway, which we know very well because we use it with hydroquinone. Other than that, we have the physical properties. Like my colleague said before, we do know that the structural support is important. Scaffolding for the dermis is important. The extracellular matrix is made of fibers, and those fibers act as scaffolds. So PN, in a similar way, can act like a scaffold. It does retain water, so it has a very good hydration effect, very similar to HA with a low G prime. And it has the mechanotransduction, which is the explanation to why all HAs injected into the dermis that exert a mechanical tension also have biostimulatory effect. So mechanical distension, is a biostimulatory effect for our cells. So that's not a chemical property, that's a physical property. And they all fillers share that. So we just went through the mechanism. I don't want to bore you with that. We had melanogenesis inhibition and growth factors production. This is the 3D molecule. This is how it looks, the scaffold in the dermis. And this is how our fibroblasts use that in order to grow and in order to proliferate. And by the end of the day, this is what we do. We inject something that is 100% biodegradable, that our body knows, and it can use it in order to heal itself, which is a very different concept than filling up volume with substances that could contain also BDDE. we'll just run through that. And I would expect, what about safety question? So PN injected intravascularly, you have them one near the other. HA injection into a vessel versus PN injection intravascularly with no necrotic effects. And for me, that is also a great game changer because it expands the indication. We can use it. We're no longer afraid of intravascular injection. So what are the clinical indications and what is available in the market in Israel? We have the REJURAN healer, which is the primary actor, is the primary mister of this story. It's a 2 milliliter injection device. It has the intermediate, let's call it cohesiveness. Then we have REJURAN eye, which is basically made for injection around the eyes for periorbital rejuvenation, and I think periorbital rejuvenation is the main indication for this product for us as a complementary treatment doing lower blepharoplasty. And last but not least is REJURAN S. They all contain 20 milligrams per 1 milliliter, but it has the utmost viscosity. They should not be used according to only just to indications. We should think about viscosity and think about our patient's skin. REJURAN S is used mainly for scars. I think Bianca showed a very interesting case of a scar, a retracted scar in the face. I think that subcision and using REJURAN S could have really helped that patient because we also have studies showing that REJURAN S injected into adipose tissue can increase adipocytes well-being. Injection normally when done into the dermis should be done into the dermis, to the dermal epidermal junction. We should be able to see those papules forming when we inject with a very short needle with a very high gauge. Injections should be done after local anesthesia, obviously, unless you really don't like the patient you're treating. And normally we would use a first cycle, and a cycle is 3 treatments done every 3 to 4 weeks, and then the maintenance would be once every 6 months. It really changes according to the indication, but that as a rule of thumb would be okay. So basic treatment areas, we are talking skin quality. And when we're talking skin quality, we can go pretty much all over the face, but also neck and décolleté, and also the back of the hands. We could be able to treat enlarged pores. We should be able to treat dark circles under the eyes, but we would have a very big difference in skin complexion and overall very good patient satisfaction, I have to say. Another thing that is, to me, a new concept is that REJURAN basically can be used with other tools in the same syringe. We can mix it with HA, with non-cross-linked HA. We can mix it with botulinum toxins. There are very beautiful works coming out of the Ukraine on scars, actually, using REJURAN S with normally between 10 to 15 units of botulinum toxin, where they are working with either Botox or Xemin for 1 cc of REJURAN. For those of you who don't use botulinum toxin for scars, it does an amazing job. Some like to mix it with lidocaine. I personally don't do that because I find it useless since we're injecting every different point just once. So I don't really see the point in doing that. But if someone begs to differ, it is possible to mix it with lidocaine. It is also possible to combine it in a combination treatment with energy-based devices. Should it be lasers, IPL? I personally use it with microneedling RF. Only rule of thumb would be to use first the energy, then the injection. I know that not the whole world of aesthetic medicine agrees with me, but for me it has a good point in doing it in that order. When we're talking about doing it in the same session, so if in the same session I'm doing a CO2 or a microneedling RF, I would inject after the energy. Another possible thing to do with it is preconditioning, and I think preconditioning is important to us as plastic surgeons when we go and when we want to perform a facelift, and like Dr. Amon said before, that he would do a CO2 in the same session in the operating room. Also, there are beautiful works about that, joining CO2 on the flap during facelifts. There's a very famous work also about TCA peeling, same session, doing it with a facelift, and not just the plain facelift, also subcutaneous. But we could also do a preconditioning. We could treat our patient 1 month before and then perform the facelift. We will have a better results. I've also seen during this last convention that we just returned from Seoul 2 days ago, very interesting intraoperative injections doing REJURAN under the flap and showing very beautiful result. They showed a split face, one face treated with REJURAN under the flap, other half of the face was not, and the half that was injected with REJURAN healed faster and had better skin quality because they did injection under the flap and into the dermis. They also reported injections in front of the earlobe to treat the scar, and they showed really a better scar. I really wanted to steal those images, but I couldn't. But it was really intriguing. I think this really opens your mind into how we as plastic surgeons can use these techniques and these tools in our toolbox to enhance our patient satisfaction. So it could be complementary to surgery, whether we're doing upper or lower bleph, if we want to work on skin quality, or scar modulation. Not biostimulation, but scar modulation as in affecting the scar and shoving it a little bit, shoving the inflammatory response in the right direction with the anti-inflammatory properties. Scar treatment combined with lasers and combined with botulinum toxins, whether it be ablative or non-ablative lasers. I think everybody knows the golden standard that now traumatic scars should be treated 1 month after healing. So I think REJURAN can really change the results in this new working phase. And also, I have witnessed, I have to say, I wanted to bring the photos, but it was not available, for a very good result with wound healing, mostly venous pathology. There are initial works coming out of the Ukraine, I have to say. I will be happy to share them when it is possible to publish them. So I think, to summarize, this is the next frontier, and I think that intelligent regeneration is not only for the aesthetic medicine practitioners. I think that we, as plastic surgeons, we should be really happy and confident to navigate those waters. I think we should really dominate that scene, because we can really implement our work using these tools. And I think we can take it further than anyone else, basically. So thank you very much. I'd just like to conclude and invite everyone to the launch of REJURAN, which is the 26th of November this year. And feel free to approach me if you want any more details.